All right, so we have all of us docs here of Ignite Chiropractic, and we have gone over some of the frequently asked questions, or what we're going to do is go over a lot of the frequently asked questions in relation to seasonal allergies. Perfect time to be talking about it, considering the time of which we're recording this. There's a lot of that happening right now. So we're excited to go through that, and like I said, we're going to individually go through different questions that we hear most often, so we can describe it to you, what it means. What are things that you can do to minimize it? What is it actually? Can chiropractic help with it? And all of that. So let's kick it off. I'll start it off with, how can you tell if you have seasonal allergies and what are their typical symptoms? Well, how can you tell if you have seasonal allergies? Just like in the name, seasonal. Well, are you starting to have itchy, watery eyes, scratchy nose, you have mucus building up in your throat, maybe you're coughing, you're sneezing? It's a lot of things that are happening around the head region. Sometimes with that too, people have fullness in their ears because they're feeling congested, and or maybe their nose is draining. There's a lot of different types of symptoms that can happen. Maybe some people may turn into headaches because they're so congested and they're creating pressure and they have headaches with it. Some people may have difficulty sleeping. They may have stiffness in their neck or difficulty moving their head from side to side. So there's a wide range of different symptoms that show up with seasonal allergies. And seasonal because, well, like we know the seasons, we have spring, winter, summer, fall, and some people will add an additional seasonal allergy. One of their other seasons is the time of which they get their allergies, funny enough, because a lot of people experience or have seasonal allergies, but how strong their nervous system is really can dictate whether or not they express those or not. So I went over what the typical symptoms are with that and how can you tell if you have seasonal allergies. Well, are you experiencing any of the things that I just mentioned, and does it just so happen to maybe happen around the time when there's pollen in the air? Whenever there's growth around springtime, which is awesome because there's a lot of fresh growth happening and everything, but at the same time, trees are releasing things are coming up from the ground, pets, pet dander and all this and that. There's a lot of things that start to affect people, maybe in the changes of the season as far as like going from cold to hot or hot to cold. Those can have effects as well. So let's go ahead and go on to the next frequently asked question. Dr. Lee, what are some of the risk factors for developing seasonal allergies, and can they be inherited?
So the risk factors, they really come down to more where you live. So if you're living in one location, sometimes people will have no issues with allergies at all where they live, but they move to a new area and they start developing allergies that they never had ever before, or they could have really severe allergies and move to a different location and those allergies tend to disappear and they tend to go away. And so it's very dependent on your location. But a lot of times we can't just up and leave. I mean, we actually had a patient who their allergies were so severe, they didn't even actually start care. I think they came in one time and they were kind of curious on chiropractic care and how it could help. And their child was suffering with allergies so severely that they could hardly ever go outside, and it was just miserable for years and years. They'd been to all sorts of specialists, and they finally decided to move to Costa Rica, outside of Northwest Arkansas, all the way out to Costa Rica with the hopes that their child would be able to not have allergies. And sure enough, it worked. They've been able to thrive and have a fantastic life in Costa Rica, but that's a pretty substantial change for someone to make when you don't actually have to, in our experience, you don't have to go through those changes in order to seek relief and be able to heal, because allergies is not something that is normal. And the other part of that question is, can allergies be inherited? It's very common if you have family members, like your parents or your grandparents or your siblings have allergies, there's a stronger likelihood that you're going to have allergies. But that doesn't mean that you're inheriting it from a standpoint of genetics where you are going to have allergies one way or another, no matter what, just because your parents did. So it's not inherited that way, but a lot of times our environment is what actually allows genes to turn on or turn off, or to be signaled, so that if you're overreactive to pollens or dust or dander, then there's certain histamine responses in the body that are out of sync, they're out of control. If you are in the same environment that your parents are in and your siblings or your family who also has allergies, then you're usually doing the same types of things that they are. You're usually eating the same types of foods that they're eating. You're usually under the same type of mental stresses that your family is in as well, and you guys are kind of everyone's in this same toxic soup together, and that has a stronger contributing effect on whether you're going to inherit the allergies more than anything else, which means that you have the capacity to change it. So that's the most important thing for people to know, is that although it may appear that it's inherited just because others in your family have it, that does not mean that you are stuck with it and that there's nothing that you can do to change that and for your body to optimize and to heal. So the next question for Dr. Chris is, how do seasonal allergies affect children, and what are some unique considerations for parents?
So you already kind of touched on it. A lot of what kids go through is typically in the family. They're doing the same things that the families are. They fall in line with a lot of the same things that we do. So whenever we talk about kids and how they respond to it, they get the same things, just they don't tell you as often. They have runny nose, they have earaches, they get crust in the eyes. You see it coming in on a daily basis in the office. But as we start adjusting them and start taking care of their nervous system, they respond a lot better. They get those better histamine reactions where those immune responses are acting proper versus overreacting or underreacting. If they're overreacting, we get a lot more runny nose, things start to plug up, but whenever we're not having that response, it doesn't respond in a way that is helpful. It's a response that causes more inflammation in the long run. So whenever we're talking about kids, what do we need to do? We need to get that brain-body connection going a little bit better. Get the brain communicating in the body. Get those reactions firing better. You got to start with the nervous system. We got to get them adjusted. And babies and toddlers and kids, they all respond differently. Babies that are fresh, they really don't have a response or know how to do it. They're really starting to adapt. They haven't learned all of this yet. Some of it they get from the mom, some of it they haven't gotten depending on how the birth went. So we have to talk about, what is the mom putting into the baby? So are they taking in enough nutrients? Are they getting enough anti-inflammatories? Things like electrolytes. Pineapple juice is fantastic. It has bromelain in it. Decreases inflammation in the sinuses. But then there's also as they get older, they're starting to develop a response. Are they communicating directly from their brain down to their spinal cord and actually having that response like they're supposed to? As they get older, they need to have that repetition of healthy responses versus abnormal responses where that communication was lacking. So there was other, some unique considerations or things that can help. Something that I found was really helpful for parents that don't know how to get electrolytes into their kids. Things like we talked about lemon juice, lime juice, pineapple juice. If you actually put that and dilute it in a little bit of water, make a popsicle out of it, the parents can use that, just kind of let their kids suck on that for a little bit, get some electrolytes in, and that can help decrease some of the inflammation and the autoimmune responses that are happening there. Those are just a few things. Of course, this can go on, and I'm getting into other people's questions here as well. But so, Dr. Sean's question, how can you prevent seasonal allergies and lifestyle changes? So I kind of touched on them. I'll let you take it from there, Dr. Sean.
Yeah, you bet. So, if we were to follow conventional medical wisdom, they would basically have us living in a bubble, living indoors, trying to stay away from any allergens, and pumping our body full of antihistamines, corticosteroids, and allergy shots. But the truth is, our body's not lacking any of these things. It has its own wisdom, and it doesn't need any of these things. And we were designed to actually be outdoors, breathing fresh air. So what we are finding, though, is that something is compromising the immune system and the nervous system and its ability to handle and adapt to the stressors of the pollens in the air. And there's a few different things. It could be the toxins that we're exposed to. One of the biggest ones I think that we're dealing with as a society, though, is stress. So if there's anything that people can do in their lives to manage stress, like sleeping better, eating better, and getting more exercise, those are going to be huge ways to impact your body's ability to handle seasonal allergies. But most importantly is getting adjusted. One of the biggest things that we can do is get the spine cleared of subluxations to actually help improve the function of the nervous system, which is then going to improve the ability of the immune system to handle seasonal allergies as well. So following up with that, we'll turn it over to Dr. Natalie. And how can chiropractic care help with seasonal allergies, and what are some of the specific techniques used?
I love it that you talked about some of the common things that people would naturally start doing, and then leading it into what the most important thing is, making sure you get your chiropractic adjustments, because that is what chiropractors focus on. We focus on removing subluxations. We focus on what is the cause, in this case, what is the cause of the seasonal allergies. The reaction that people are having, kids, no matter what age it is, allergies, truly, as we had talked about in some of the other questions, what are some of the symptoms? They're like common cold symptoms, right? And really what it is, it's your body detoxing and getting things out of the body that are not supposed to be in there. And the ability for somebody to be able to remove that, to eliminate that out of their body, is going to be totally variable depending upon how old they are, what's the environment they're living in, what type of foods that they're doing, what other stressors are affecting their body, of their ability to be able to clear that stuff out. So how can chiropractic care help with seasonal allergies? Well, just as we do all the time, is we're going to go in, we're going to check the nervous system, we're going to check the biomechanics of the spine that encapsulates and protects the spinal cord to see how everything is functioning. Where are the nerves being pinched off or compromised so they can't communicate to the rest of the body like they're supposed to? And in this case, a lot of times, it's a lot of things that are happening up in the head and in the neck region. It could be mid-back, but also can be low back, but mostly in the upper half of the body. So we really want to make sure that everything is moving, all the nerves are communicating the way they need to, so we can get to the direct cause and the issue of what's causing those nerves to not communicate to the areas within the lung right there, for your sinuses getting filled up too much, to not be able to push things out as effectively. And also, I want to touch base on the fact that your body is coughing, that you are getting sniffy, that you are needing to blow your nose, that you are getting itchy, watery eyes, is your body's natural, inborn, innate wisdom working for you to get these stuff out that should not be in it. So we need to look at seasonal allergies a little different. Now, yes, are there varying, like if it's too much or not too little, but it's like, well, your body is effectively getting something out that's not supposed to be in there. First of all, so be proud of your body's wisdom. Trust in your body's wisdom and its ability to heal, because the body is a self-maintaining, self-sustaining, self-regenerating machine, and chiropractic is a fantastic way to be able to activate that power from within by delivering the chiropractic adjustments. So what are the specific techniques? Any chiropractor who is trained and understands and knows the wisdom of the body will be able to utilize the chiropractic adjustment regardless of the technique to be able to activate that inborn wisdom in each and every person, regardless of the age or what type of background they may have come from. So for me to say what are some of these specific techniques used, well, any chiropractic technique, but there might be some additional things that people might utilize to help drain the sinuses, to help direct where the drainage should be happening. So there might be some things that they might be doing, trying to go around the sinuses on the upper half of the eye, underneath the eye, draining it down in here, tapping around this area right here, thumping right on the thymus region right here. There's also craniosacral techniques that you can do working around the head specifically, and also just on the back side of the head right there, on top of the adjustment of whatever it might be, considering the doctor and their technique and their level of knowledge when it comes to what their technique is. So that was a broad way of describing it, but I don't want anybody to get too tapped into just only that. That's a seasonal allergy technique. There is no seasonal allergy technique. There's a technique to remove subluxation, and that's what we want to focus on. So moving on, Dr. Lee, the next question that we hear a lot is chiropractic care safe and effective? Is it a safe and effective alternative to traditional allergy treatment such as medication?
Well, first thing is we kind of have to flip that question around, because medication safe? Medication is absolutely not safe, even though it's very common and you can get a lot of things over the counter. You can get, Claritin, Allegra, different things that are antihistamines to help clear up the symptoms. Most people are unaware that these have significant side effects. And that people know the antihistamines, they can make you drowsy, and so a lot of times people don't like to take them because they make them sleepy. But that's just one small side effect that people go, oh, if I'm a little bit sleepy, no big deal. They're unaware of the other things that are actually happening inside of their body when they're taking these, not just in a single dose, but consecutively, multiple times a day for weeks or months on end. Sometimes people are taking them year round. There are significant health consequences to that. All someone needs to do is look up whatever they've been taking and type it into Google and find out what the side effects are, and you'll see the most common to the least common symptoms and side effects of these medications. Now, when you talk about chiropractic is, when we say what the question was, is chiropractic care a safe and effective alternative to traditional allergy treatments? Chiropractic is not a treatment. Chiropractic is not a treatment for anything. We don't treat seasonal allergies. We don't treat neck pain. We don't treat low back pain. We don't treat a toenail infection. We don't treat anything. What chiropractic does is it works with the innate potential of the body to heal. And that innate wisdom is housed in your brain and your spinal cord, and that's how the signals make it to communicate and coordinate how the body functions. You shut off that, you shut off the power of life inside of the body. So what chiropractic is doing is it's assessing along the spinal cord, where are there any interferences that are showing up? And if there are interferences to that innate wisdom of the body, it will not be able to be expressed. And we make corrections to that to make sure that that alignment is put back into a proper position of the spine, which opens up the capacity of the body to operate the way that it's supposed to, and it's going to achieve a more optimal state than it was achieving before. That's the whole goal of chiropractic. So it's not to treat a particular symptom. The side effect, so to speak, within chiropractic is if you have these symptoms, if you have problems in your body, when you start to enhance the performance of the body's ability to communicate, you are also enhancing the performance thereby of the body itself. And it's not a natural state for people to have allergy, or have allergies. Think about how ridiculous it is that someone is to go outside, and I used to be this way, so I'm not making fun of it, but it is a ridiculous notion that someone's allergic to dirt, dust, pollen, and dander. We're allergic to the earth. How could we be allergic to the earth? No, it's because our body isn't functioning properly. Because certain times of the year you don't have any issues with that. And maybe earlier in your life you didn't have a problem, and suddenly now you have an issue. At what point did it become a major threat to your body? It was because your body got disconnected, your body got weakened, your body was broken down. So whenever we look at chiropractic care as a safe and effective alternative to traditional allergy treatments, I really have to be strong on making that distinction that chiropractic isn't to treat anything, but the side effect is we see patients every single week, especially during allergy seasons, who are coming off of their medications. They're no longer having to take their allergy shots. They're going for the first time through an entire allergy season without having any symptoms whatsoever. And this is a fairly common experience that we have, yet like you were alluding to, there is no adjustment that we make specifically for, make sure to give me the allergy adjustment. There's no allergy adjustment. We make the adjustments wherever they show up, and then the body will heal itself as it sees fit and as is necessary for that person. And that's how chiropractic works to assist in the body's ability to not have allergies. So moving on, Dr. Sean, we're going to get sciencey here. So what is the science behind chiropractic care and its impact on the immune system, and how does this relate to allergies?
So when we look at the science, there's a lot that we know and there's a lot that we don't know. Anecdotally, you could go talk to just about any chiropractor and they could give you dozens and dozens of case studies and stories of patients that, as you were just explaining, they start getting adjusted and their seasonal allergies go away. So on one aspect, we do know it works with or without any evidence from the science, but here's what we do know. When we remove the subluxations from the spine, we get better movement and function of the spine, which has a direct impact on the function of the spinal cord and its relay of information back up into the brain, back and forth between the brain and the body. As we get better communication between the brain and the body through the spinal cord, it improves the overall function and health of the brain, which has a direct impact on modulating the immune system. Our brain is the master communicator of the entire body, including the immune system. So as you get better modulation of that immune system, in turn, that's going to create a better adaptation response to whatever the stressors may be, whether it's pollens or grains or animal dander, whatever it could be. And thereby, when you get better modulation and adaptation, then your response to those allergies becomes less and less and becomes dampened over time. So we see by getting adjusted, you can have a huge impact on the seasonal allergies. So that's going to lead us into our next question for Dr. Chris. Are there any risks or side effects associated with chiropractic care for seasonal allergies?
So, quick short answer, are there any risks? No. Not whenever it comes to these type of adjustments and whenever we take care of the spine. As we get the body healing, it responds better. Like Dr. Lee was saying, this isn't a treatment. This is reconnecting the body's communication to itself, allowing it to go back to its healing nature. If you get a cut on your arm, what happens? It'll scab over. Once it scabs over, what happens? It heals and it builds a scar. what we're doing is we're not letting the body get back to its normal spot when we have subluxation. So whenever we have subluxations, it's like we keep scratching the scab off. But as we get adjusted, we start taking care of the spine, it allows that to scab over and scar over just like it's supposed to. Your body responds like it's supposed to. But whenever we're talking about side effects, that is a side effect of having a body with a proper response. Your body goes through histamine reactions. It creates normal function of fluids in the eyes and fluids in the nose to help protect your body, to help it function a lot better. So a side effect is for adjustments, it's usually like a bonus. You get an adjustment, your sinuses start working better, everything starts feeling better. It just works, and it just feels better. For instance, this week alone, we've already seen a couple hundred people this week, and probably about 20% of them had sinus issues, and more of them are new to chiropractic. But most of the people that have been here for a long time, they come in, they're like, I haven't had allergies in a while. I don't even know what you're talking about anymore. It's allergy season? Yeah. Everyone's feeling better, and they're more regulated. Their body knows how to respond whenever Bradford pears are in bloom, and everyone's feeling a little bit more on edge. But we see that response a lot less after you've been taking care of yourself a lot longer. So risk and side effects, it's no risk, really good side effect. So that leads us to the next one, Dr. Nat. How often do you see a chiropractor for seasonal allergies, and how long does it take to get results? So feed right into that.
That is definitely a great question, and we do get a lot of patients asking about that, and just people in general. And unfortunately and fortunately, I have to say every case in person is different, okay? Because absolutely is that. Every person is different. What is your age? What are the variables? What part of the country are you living in? In this case, we're living in Northwest Arkansas, right? Well, what are you exposed to? Do you have a lot of trees around your area? What are the foods that you're eating? What's your home life like? What's your stress life like? Even if it's a newborn baby, like what was the uterus like? What was the womb like whenever the baby was in utero? And then when the baby came out, like was the baby breastfed? Because that was the natural, well, let alone coming out the vaginal canal, that's its first natural inoculation. Truly is what it is. And then you go through and you get all these beautiful immunoglobulins whenever they're feeding off of the breast. And so that's its natural chemistry that you're getting from mom. And on top of the fact that mom's creating that chemistry, of course the chemistry matters on how well the mom is nourishing herself, on the quality of the milk that's coming out for the baby, but that's a whole nother conversation. So when it comes to how often you need to see a chiropractor for seasonal allergies, well, how often do you need to see the chiropractor for the subluxations you have in your spine is really what we need to find out. So how do you find that out? You come into the office, you get your spine checked, you get an assessment, you get x-rays taken, we check your nervous system to see how well it's functioning and how many subluxations you have in your body. And what I'll tell you is that more often than not, you're not going to just come in once a week frequency when you have 6, 4, 3, even just one subluxation in your body. It's going to take time and repetition in order for your body to start to relearn how to function properly as that subluxation is being removed, and for your body to, yes, modulate properly, function properly, start and relearn how to form those pathways in the nervous system to function properly again. So you're going to start off at a frequency of likely 3 times a week. And then you're going to continue that on. We have a corrective care phase because we're correcting the subluxations in the body for a reason. And it just so happens a lot of the side effects, in this case, of getting your subluxations corrected is you don't have these symptoms of allergies. And how long will it take? Well, it's also probably a little difficult for you to recognize it depending upon the time of the year that you're starting your chiropractic care. And then it going through the cycle of the year to know when that seasonal time of the year, the seasonal allergy time comes around again, to know if you even respond to it the same way. So again, every case in person is absolutely different, but what I'll tell you is you come in, you get your subluxations removed, and you're going to be on the course of healing your body inside out without medications, without drugs and pharmaceuticals, getting your injections or your weekly injections, whatever it might be, and allow your body to heal naturally from the inside out with chiropractic care. So, Dr. Lee, can chiropractic care help with specific allergy symptoms such as congestion or post-nasal drip?
So, good question, and short answer is yes. The common allergy symptoms like congestion, post-nasal drip, basically means that you can't breathe and you're blowing your nose all the time. And that's what we most commonly see patients that are coming in for, that notice improvements and changes in how they're functioning throughout the season. Is usually they're coming into an allergy season and they're like, wait a second, this is the first time I haven't had to had to be blowing my nose all the time, or like my eyes aren't just super itchy, or I can't breathe through my nose, and they're noticing that things have changed for them. And that's kind of the way that it tends to go. Is it's not like if you come in with allergies and you're in the middle of the allergy season, you may not notice the impacts of chiropractic care right off the bat. You may not notice that. You're waiting for it. You're like, I want to see if I get improvements. Sometimes people do. And start noticing them very quickly and then changes. But usually it's that next allergy season, to piggyback off what you were saying, Dr. Natalie, that they start noticing, wait a second, okay, I was really bad earlier, but now it's been several months down the road and I'm doing so much better, and now everyone else is blowing their nose and they're talking about allergies, and I'm not this year. And so that's a big deal for them. Now, one thing I do want to point out is that kids that have allergy symptoms, this is an abnormal immune response. And a lot of times these kids are the ones who get tagged as being sick all the time. These kids they always have the cold, they always have a runny nose, they always are having congestion, they're always having ear issues and ear troubles. Well, it may not be necessarily that they are actually sick, but the problem is that the common cold looks just like allergies. Or seasonal allergies. They look very, very similar in their presentation. In fact, it's kind of hard to tease one out from the other. And often it's just an abnormal immune response, because the mucous membranes have secretory IgA, which is an immunoglobulin that needs to be balanced and in check. And if things start getting out of sync, and why does it get out of sync? Well, if the nervous system isn't functioning, because the nervous system controls the endocrine organs and the exocrine glands, so endocrine and exocrine glands are under the control of the nervous system, and guess what that affects? That affects your sinuses. And so these kids are being out of balance at the nervous system level, which controls how the immune system is functioning, and then they wind up running around having, being labeled as a sick kid, snotty kid, always getting sick, seasonal allergies, and they start getting adjusted, and all of these things within a matter of months start to clear up for them dramatically, and they are no longer labeled that sick kid anymore. And that's the magic of it. And again, we're not treating allergies as chiropractors. What we're doing is we're looking and assessing if there's dysfunction in the spine. The spine is protecting the nervous system, and the nervous system controls and coordinates the function of every other system in the body, including the immune system. And that is what makes the difference in these kids' lives, or adults for that matter as well. And we just see fantastic results when people are getting their spines checked and cleared of subluxation. Now, moving on to the next question we got for Dr. Chris: how does chiropractic care fit into a comprehensive treatment plan for seasonal allergies, and what other therapies may be recommended?
So, like you were saying, we're not treating the allergies. We're not treating the seasonal allergy portion. We are treating the spine. As we take care of the spine, the body responds better, which means that your seasonal allergies become less, and typically less often throughout seasonal times where they're like, oh, I don't have seasonal allergies anymore. Like I was saying, it's more of a bonus. As you start taking care of the spine, you come in, we start taking care of the cervical spine, the thoracic spine, the lumbar spine, and the sacral portion of the spine. All of those start to come into balance, which means that the nerves can fire correctly, and we have a proper immune or autoimmune response. That is how the chiropractic care fits in the treatment plan portion, because as we put them on a plan, get some frequency, get some regularity to how their body is functioning and their nervous system, that frequency retrains how the body is supposed to be functioning. But there's a lot of what's called muscle memory. A lot of people know that word. As we start to retrain that, their body starts going into a proper response. We see that regulate back down, and allergies are typically no longer a problem. We see that on a daily basis. Whenever we actually just went in for a re-exam, Dr. Sean and myself, and the number one thing that they saw at their first re-exam in 1 month was their allergies were non-existent, which they've had them for years. So just at one re-exam, that was 3 times a week for a month, and they were already seeing those changes that they've had for decades. So huge changes there. And then whenever we talk about other therapies, there are several different things that a lot of people do. They'll do things like neti pots, flushes to get a lot of the sinuses rinsed out. One of my favorites, just to add in, I kind of touched on it earlier, is a healthier diet that is less inflaming. So avoiding sugars and dairies that increase the mucus, but also, like I said, pineapple has fantastic decreasing inflammatory properties. So it has what's called bromelain in it. Bromelain is an anti-inflammatory, and it really, studies have shown that it focuses on the nasal canal and the nasal area where it decreases that inflammation. It makes things function and actually a lot more fluid. So as for therapies, 1, get adjusted. 2, try getting a healthier diet and avoiding sugars and dairies. Another one is go outside, get some vitamin D. You know, if you can, if it's not inappropriate, take your shirt off, get some sunlight on your skin, start getting those photoreceptors firing a lot better, get that vitamin D absorption, help boost that immune system on another level. Those are a few things that I would start with. I wouldn't go into medications if you can avoid it. I would start with the better things that don't have side effects as well. So that's where I would go with the other therapies. But lifestyle changes, Dr. Sean, are there any lifestyle changes or modifications that chiropractors may recommend for managing seasonal allergies?
Man, I love that pineapple juice.
It's my favorite.
I do. Drink it every day. So, yeah, absolutely. This kind of, just to build on some of the previous questions we've had, one of my favorite quotes by one of our colleagues, Dr. James Chestnut, we could really sum it up really, really simply and say, eat well, think well, and move well. Mm-hmm. You look at those 3 aspects of your life, and that's going to really, we talked about stress earlier, and it's a really great way to manage and reduce stress, reduce the toxic overload that our bodies are dealing with, is just to break it down into eating better, making sure that our thoughts are positive and moving forward, and that we're getting great movement in our lives. But most importantly, and I'm going to tie this into my own personal testimony, is getting adjusted, okay? As a child, I used to have extremely bad seasonal allergies and hay fever. I would go into sneezing fits, the whole snotted up things. I couldn't even see out of my eyes. They were so wet from it. It would happen every year during harvest time for about 3 to 4 weeks, and it was just pretty intense. It would be pretty unbearable at times. We even tried doing allergy shots, where I would have to try to, they'd figured out certain pollens and danders that I was allergic to, and then I was trained on how to give myself these shots, trying to increase my immunity to these. But the truth was, as I was doing these, I could never really tell if I was feeling better or worse on these shots. And after a year of it, I was like, I'm done. Like, no more of this. Time goes on, I start noticing that I'm also having allergies during springtime when the snow melts and all those dust and pollens get released in the air. So at a certain point in my life, something changed. I started getting adjusted. Now, for me, it wasn't immediate. With some patients, a few weeks, a few months, and they start noticing a change. But it was really over the course of a year, 2 years, and even a decade. Really within the first year, I was like, something's different. My allergies aren't as intense. And every year that went by, I would be like, whoa, they're less intense, to the point now, I get an occasional sneeze when allergy season comes around, and it doesn't even faze me or affect me anymore. So point being, get your spine checked for subluxations, get it adjusted as needed, and it has a huge impact on improving your nervous system and how that's going to help its role in modulating and managing the immune system moving forward. So that brings us into our last question for Dr. Nat. What would you look for in a chiropractor when seeking treatment for seasonal allergies, and how can you ensure you find a qualified and experienced practitioner?
I love that question, because really every chiropractor who has gone through chiropractic college in order to receive a chiropractic license and a degree should know the principles of chiropractic, which is knowing and trusting in the innate intelligence within the body, the principle, what we call the philosophy of chiropractic, which are just truths in general of the body being a wise piece of machinery. It's self-maintaining, self-sustaining, self-regenerating. That spark of life that created us is the same spark of life that is housed inside of our nervous systems, knowing that our nervous systems control and coordinate everything inside of the body, from breathing, from digesting, from heart beating, all the things that you don't think about. And thank goodness so many things that you don't have to think about, because goodness knows that people would not be able to do it. They would be just overwhelmed. But that being said, every chiropractor should have the understanding of the innate wisdom inside the body. So whenever you're seeking a chiropractor to see what's the best one for you, it's a chiropractor that is seeking to detect and correct vertebral subluxation. the chiropractor that is going in and not telling you to try do all these additional things and rub a dub here and start pressing and prodding in here. No, they are the ones that are going in and knowing that they want to activate and ignite the innate healing potential within each and every person that comes into their office and instills that wisdom in you. That's the correct chiropractor to be going to, is the one that's going to reinforce that, because you don't know that otherwise. So many people have forgotten that their bodies actually are doing and working in their favor, that their body is always trying to help them and not work against them. So the chiropractor that is reminding you that your body is working for you, but it just doesn't know how to function anymore. You have too much stress, too much vertebral subluxation, and that needs to be removed and detected and corrected through chiropractic adjustments, whatever that technique may be. And so it's not a matter of finding like the person who does this particular technique. Perhaps you have a favor of, different techniques. You use more hands-on techniques. You might hear some popping, twisting, or cracking, where other techniques like what we utilize in our office is very specific, very gentle. We use a torque release technique, so it utilizes 3-dimensional adjustments in there so that it gets right in and communicates with the nervous system at the frequency at which nerves readily respond to and activate with, without having to do any particular, no strong maneuvers, no twisting you up like a pretzel or anything like that. Not saying that is bad. What I'm saying is that we, and each and every chiropractor is going to be markedly different. In our office, we utilize the torque release technique. So making sure you find a chiropractor that is going to help you activate that wisdom within you and removing the vertebral subluxation with whatever technique that may be. And so that's how you find out if they're qualified and experienced, is that you should get that information from, if it's not on their website, that whenever you call the office, that their team that's answering that phone and is getting you to come in, that they're going to do a full history consultation and examination to find out what is going on with you, so they can also get to the root cause of why you're having your seasonal allergies. So all of that said, we've just addressed 13 of the most common questions that we get whenever we have patients or anybody asking about, do you guys help or treat with, does chiropractic help with seasonal allergies? Hopefully that provided a lot of information for you, gave you a lot of food for thought. Make sure you share this with loved ones so they too can receive the benefits of chiropractic care.